My name is Alvin Liang, and I'll be discussing Crohn's disease for my project. In this presentation, I'll be going over the basics of the disease, such as signs and symptoms, risk factors, treatment options, and the direction some of the research currently being done on the disease is heading towards. Crohn's disease, or CD, is an autoimmune disease that is characterized by skip lesions and inflammation of tissue along any portion of the gastrointestinal tract. The symptoms include spots of fever, weight loss, and chronic abdominal pain that can be easily misdiagnosed for other diseases. Due to the multifactorial nature of CD, it is difficult to pinpoint the exact causes, but the risk factors fall into two general categories: environmental and genetic. Family history and genetics does link to increased risk of developing CD, but not by much. Only 10 to 25% of all patients also have a first-degree relative with the disease. Research has also disproved the theory that sweet beverage consumption leads to increased risk of developing CD. The environmental factors have to do with modern drugs and substances such as tobacco. The rate of developing CD is doubled for cigarette smokers, past and current. While not as significant as tobacco, it is important to note that non-steroidal anti-inflammatory drugs, antibiotics, as well as oral contraceptives can also lead to an increased risk of developing CD. There is no known cure for the disease and no standardized therapy among all patients. Treatment is geared towards symptomatic improvement and control of the disease process to improve quality of life and reduce progression and complications. They use anti-inflammatories to reduce swelling, immunosuppressants to extend remission periods, and in some cases, surgery such as proctocolectomy. One of the leading research efforts for treating Crohn's disease is probiotic therapy, the introduction of microorganisms in small controlled dosages to provide health benefits. Through probiotics, healthy microbes are protected, the mucosal surfaces of the intestine are fortified, and the colonization of pathogenic microbes are halted, preventing progression of the disease. Another area of focus for research on CD is the use of nanomachines to administer the drugs to affected areas. Using nanotechnology, they can reduce the exposure of normal cells to the medicine applied and also reduce drug overusage. This can also help correctly control dosages on a patient-by-patient basis to scale dependent on the severity and progression of the disease. If you would like to read more about the aforementioned research or learn more about the disease, links are provided below. Although there are many complications that come along with the onset of Crohn's disease, with proper medical treatment, many are able to cope with and lead productive lives. That concludes the end of my presentation. Thank you very much for watching, and if you have any questions, please contact me at axl8713@g.rit.edu.